Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. We are now going to look at the vitamin deficiency states. So, vitamin deficiency states. So, the first vitamin we are going to see is the B1. So, B1 stands for the thiamine. So, thiamine is associated with deficiency is associated with beriberi and also the WK syndrome, that is the Wernicke-Korsakoff syndrome. Next, we move on to B1. B1 is over, so B2 is known as the riboflavin. Riboflavin, it causes chelosis. Chelosis, that is also the magenta colored tongue. Magenta colored tongue. Next, that can cause glossitis and seborrheic dermatitis. Then we move on to the B3. B3, it stands for the niacin. So niacin, there is associated with a deficiency state known as pellagra. There are some clinical findings such as dermatitis, 4Ds. So here mainly the dermatitis, diarrhea, as well as the dementia. Next, we have the B5. So talking about B5, it is the pantothenic acid. Pantothenic acid. And this is the deficiency, it leads to the burning foot syndrome. Burning foot syndrome. And historically, it is also known as the nutritional melalgia. Nutritional melalgia. So the other findings, it causes dermatitis. There is dermatitis. There can be enteritis. There can be alopecia and ataxia. Next, we move on to pyridoxine B6. B6, it stands for pyridoxine. So pyridoxine, the deficiency state, it leads to the microcytic anemia. Microcytic anemia. It can also lead to the convulsions, as well as there can be depression. Next, we move on to biotin. B7 is known as the biotin. So under biotin, this is it can lead to the dermatitis. Can lead to dermatitis, the atrophic glossitis, alopecia, paresthesia, muscle pain, paresthesia, muscle pain, as well as it can lead to the anorexia as well as the hallucinations. Then moving on to the B9, important one, that is the folic acid. B9 is nothing but the folic acid. So folic acid, the deficiency leads to the megaloblastic anemia, megaloblastic anemia. Next, the neuropathy, the NTDs, that is the neural tube defects, as well as the atrophic glossitis. Next, we move on to the cobalamin. So cobalamin, it leads to the deficiency. Cobalamin is nothing but B12, and this deficiency leads to the pernicious anemia. So it is the pernicious anemia. Next, there is dementia, spinal cord degeneration, and can lead to dementia as well as the spinal cord degeneration, we are writing as SCD, and the homocystinemia. Lastly, we are talking about the ascorbic acid. Ascorbic acid, So under this ascorbic acid, this is nothing but the this is vitamin C, ascorbic acid, and the deficiency state is known as the scurvy. Next, there is presence of ecchymosis. So there's ecchymosis. There is bleeding gums. There is the poor wound healing, as well as fatigue, joint effusion, as well as there can be the scorbutic rosary. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.